to our viewing and listening public in Trinidad and Tobago and abroad. Welcome to another Ministry of Health's update on the national COVID-19 response for Wednesday, 16 March 2022. Our presenters this morning are Dr. Roshan Parashram, our Chief Medical Officer, Ministry of Health, Dr. Avery Hines, Technical Director, Epidemiology Division, Ministry of Health, and Dr. Janine St. Bernard, County Medical Officer of Carney. And of course, I am the Corporate Communications Officer at the Ministry of Health and your moderator for this media conference. We begin with the latest clinical update presented by CMO Dr. Roshan Parashram.
Hi, good morning. Thank you, Mr. Alexander. Good morning to Drs. Hines and St. Bernard, members of the media, members of the viewing and listening public. So we'll begin with the dashboard for the 15th of March 2022, update number 1029. Beginning on the top, we're looking at the graphs, population vaccination status, fully vaccinated at 50.4%. And in terms of numbers, those are 706,234. And those who have not received any doses so far, or one dose, 693,786. In terms of our booster administration, we are now at 141,180. Our new positive cases over the last 24 hours, 242, and deaths reported during that period, 4. Condolences to the families of all of those persons. The total active positives now stand at 12,752, and those cases, total patients hospitalized, 211, and that is between the step down and the hospital. And just to break that down a little further, so we have in total number of persons in hospitals 191, and those are spread amongst the Couva Hospital and Multi-Training Facility. We have 52, 7 in ICU, 2 in the high dependency unit. At Cora, 26, Augustus Long Hospital, 34, St. Anne's, 2 persons, Arima General Hospital, 34, St. James Medical Complex, 30, Scarborough Regional Hospital, Fort King George, 10, and Scarborough General Hospital, Signal Hill, 3 persons. In terms of our step down, 20 persons, all of those persons actually at the Point Fortin area hospital at this time. Looking again at the patient by vaccination status, hospitalized since July 22nd to 9th of March, 82.7% of those would have not been fully vaccinated, 17.3 fully vaccinated at the time of admission or during their course of their stay. Total deaths by vaccination status as of March 9, 2022. The small green bar at the bottom accounts for those who would have been fully vaccinated at the time. 250 persons out of a total of 3,690 deaths over the full period. So, Mr. Alexander, that's my brief clinical update for this morning.
Thank you very much, CMO. And Dr. Hines will now follow with the epidemiological update.
Thank you, Mr. Alexander. Good morning to the Chief Medical Officer, to Dr. St. Bernard. Good morning to members of the media, members of the viewing and listening public. If we can have the next slide, we'll go straight into the epidemiological update. And that slide gives us what we call our epidemic curve. Not seeing the slide yet, but as you would be aware, we have a track from July 2020 all the way through 2021 and into the beginning now of 2022 of the cases that were accrued by date of swabbing. This gives us an idea of when people presented to the healthcare system and the numbers in which they presented. All the way over to the right-hand side of this graphic, we see 3 colors: light green, blue, and a little bit of orange or brown, depending on how it renders on your screen. And those are the months January, February, and the beginning of March 2022. And for those months, we do see that there is a progressive decrease in the numbers of cases presenting for swabbing and turning up positive on a daily basis over the 3 months of this year so far. So that dotted line rolling through the graph, that rolling average, is also showing a somewhat downward trend as we move from January into February and now into March. If we go to the next slide, we see that same data basically aggregated, put together now at a weekly time scale. And we see a similar pattern where the bars in January, the green, are a little taller than those for February on average, and then those for February are a bit taller than those for March. So that downward trend in numbers by week is being maintained, and we're also seeing a downward trend in that background salmon section, which represents the positivity. And whereas in January we would have seen levels of positivity around 70% of those who were presenting with symptoms and are being swabbed, we're now seeing that we're down to about 32% or so of those who present who are now testing positive for COVID-19 when they are swabbed. So this is again an encouraging trend towards lower numbers and hopefully a more manageable phase of the epidemic. Moving to the next slide, we really just see the same data now aggregated into a table that gives us the percentage change from week to week. And we'd see that from the completed week, Epi 9, to Epi week 10, there was a 19.8% decrease. So that's almost a 20% drop. And we will see what happens for Epi week 11, but we're hoping that that downward trend continues. Moving to the next slide, we see that same data again, now aggregated at a weekly basis, at a monthly basis. And that monthly time scale shows the drop from January to February. 19,650 cases in January, 16,218 for February, and so far we're halfway through March, and we have 5,626 cases as at yesterday. So downward trend noted both in the numbers and in the background positivity. Moving to the next slide, we see the demographics for those who tested positive, and those demographics have remained fairly constant throughout the epidemic. We've seen that there have been about 50-50 males to females, and the main age groups affected are those 25 to 49 years of age, and that's about half of the positives that we've been seeing. Moving to the last slide, we see that there's a change in the distribution when we look at the fatalities. The fatalities are more common among the older individuals, and they're also more common among persons with comorbidities being pre-existing illnesses. We'll speak a little bit more about that later. And also, as we've been noting and reminding the population, the fatal outcomes are definitely much more common in those who are not vaccinated. So again, we're making the plea and the recommendation that all those who can be vaccinated, especially those with comorbidities, make sure to avail themselves of the available vaccines to reduce your risk of an adverse outcome. So with that, I will turn you back over to Mr. Alexander.
Thank you very much, Dr. Hines. That was our latest epidemiological update. World Salt Awareness Week 2022 takes place this week, 14th to 20th March. The Ministry of Health has been shining a spotlight on ways we can reduce our salt intake and improve our health by shaking the habit. With that in mind, it is my pleasure to welcome back Dr. St. Bernard to speak about the negative outcomes of excessive salt intake and some simple lifestyle changes that can be made to shake the salt habit and improve our health. Dr. St. Bernard, good morning.
Good morning. Good morning, CMO Dr. Parasram. Good morning, Dr. Hines. Good morning, Mr. Alexander. And thank you for having me back again. I am so happy to be here on a Wednesday because in County Caroni CMOH office, we have actually started Wellness Wednesdays. And there are many simple steps that we can take to live a healthier life. The importance of the National NCD Management Agenda was made even more evident with the impact of COVID-19. We are aware that 80% of persons who passed away from COVID-19 had some comorbidity. This week, we recognize Salt Awareness Week, and we wanted to take this time to encourage everyone to apply simple daily strategies so that we can reduce our salt intake and reduce our risk for hypertension. First slide, please. Avoid adding salt in your food. This may sound like a tall order, but this is something that we need to try to do so that we can reduce our salt intake. We know as a country we are known for our foods. People leave far and wide and come here for our foods because they are so delicious. But unfortunately, many of us use salt as a way of giving flavor to the food, and we need to be avoiding salt. One of the reasons we need to be avoiding adding salt to our food when we prepare our foods is because we already get a lot of sodium in our packaged foods, our processed foods, which we will be seeing in another slide. But we want that we don't then add salt when we are cooking, knowing that many of us already consume foods that have a lot of salt in them. Next slide. Okay, I can't see which slide they have there. It is so far. Limit, right. We need to limit our salt intake to roughly 1 teaspoon of salt per day. And that actually translates to roughly 2,300 milligrams of sodium. Table salt has roughly 2,300 milligrams of sodium. And that is the max, really, that we should be having. We need to be having less than that if it is we have hypertension. If you know you have high blood pressure, then your goal for the day will not be that 1 teaspoon of salt. And even seeing 1 teaspoon of salt, some people may think, but how much salt do I add when I'm making chow? Or how much salt, do I have when I consume things like salted prunes? There's so many things that we consume in this country that already have lots of salt, but we do need to try our best to limit the amount of salt that we are adding to our food. And 1 teaspoon really is the max that we're going for. Next slide. You all are challenging me. Read your food labels. Okay, the order is different to mine. So reading food labels is something that we can do and we can start today. When you go to the supermarket, the grocery, the parlor, and you purchase something, you need to be looking at the back. Oh, yes, that would be great. Thank you. We need to be looking at the back of the package to see how much sodium. So when we talk about salt, we are talking about sodium. So we need to be reading to see how much sodium is in the packaged foods that you are purchasing. And also remember that when you're reading the labels, you need to be aware that there's something called a serving size. So you may buy a pack of crackers and it's actually 2 servings in that pack. And so if you see a certain amount of sodium, you need to then multiply that, right, by 2 if it's 2 servings, so that you then you don't consume twice as much sodium as you think that you are consuming. So reading your labels is something that we can start doing today, and we want to encourage not just parents but children as well. Teach everyone how to read labels so that you have an idea of how much salt is in your serving. Avoid products that have more than 200 milligrams of sodium per serving. And like I said, if you have high blood pressure, your goal would actually be to aim for less than 1,500 milligrams of sodium per day. So that's obviously less than the teaspoon. And then if you are looking at improving blood pressure or improving your heart health, then you want to aim for less than 1,000 milligrams of sodium per day. Next slide. Thank you. Eat fresh vegetables and fruits. Buy fresh poultry and meat. That is such an important thing to factor into your daily living. We need to not just be purchasing our foods from the supermarket and the grocery. We need to be going back to the market, right? We can get our fresh vegetables and our fresh fruits and our fresh meat right from the butcher in the market. So we want to look at getting more fresh fruits and vegetables, because in having fresh fruits and vegetables, it means you are not consuming foods pumped full of sodium, but you are consuming and controlling the amount of sodium by starting with fresh and then you adding how much salt you want to the meal. Next slide. Reduce or avoid processed and packaged food. So that's something that I mentioned earlier, and that is something, even if you forget everything that might have been said today, if you start by saying, let us stop or reduce the amount of packaged foods that we are consuming, you will be making an impact and reducing the amount of sodium that you are consuming on a daily basis. You can make this a project as a family where we say, kids, this week or this month, we are not buying any snacks that are packaged. Our snacks are going to be our fresh fruits and vegetables. You can do it as a workplace where we say we are not having high sodium foods coming in. Do not bring in any processed foods. I know people are probably looking at me now and saying, say what? But that is something that we can really aim to do. If we reduce packaged foods, we reduce the processed foods, we will reduce the amount of sodium that we're consuming and give ourselves a fighting chance, a better chance at health, and a chance at having less hypertension, which we know is one of those diseases that's very prevalent right now in our population. Another slide. Cook more food at home. I don't know how many of us already are cooking regularly. Maybe since the pandemic, I know many of us, places had closed down, and I know some of us would have been waiting with bated breath for them to reopen, but we really do need to make an effort to cook more food at home, because again, when you cook food at home, you are controlling the amount of salt that is added to your meals. We need to not be ordering in as much. I know there are many, many places that, provide food that is not just full of salt, but also prepared in such a way that is not healthy. It might be deep fried, for example. We're not calling any names, but we really do need to try to cook more food at home. And even if you can't cook every single day, 7 days a week, you can then say, well, maybe we'll cook twice for the week, and you cook enough that it lasts more than one day. And so you're able to control the amount of sodium and therefore reduce the chances of hypertension, heart disease, and all the things that go with having too much salt. The thing with having too much salt is we actually are putting pressure on our kidneys. And we recently would have been focusing on kidneys with regard to health. And so when we have a lot of salt, what it does is it puts pressure on the kidneys. The kidneys then have to retain fluid. And when we keep a lot of fluid in the body, that then makes our arteries thick and hard, and it makes the blood pressure go up. And so we don't want to be having too much salt for that reason. Any more slides? Use spices and herbs for flavor. So this is a classic one because we actually do have lots and lots of fresh herbs and spices at our fingertips. Many of us have started growing our own kitchen gardens. And so you're growing your own shadow benny and chive and parsley, right? There are many, many spices and herbs that we can use to flavor food instead of salt. Some people even say they might use lime juice or lemon to add that flavor and to, bring a kick. And then, of course, many of us like spices like actual pepper. So let's look at and start exploring other forms of herbs and spices and other forms of seasoning so that salt is not our go-to for making our meals more delicious. Also, what I would want to add is that salt is just one part of the equation. Reducing our salt intake is important for our health, but we also need to reduce good old sugar, right? We're aware of sugar as an additive and something that we include in our meals routinely. Also in the processed foods, let us reduce our sugar intake. Let us drink water. Can we make that a goal? To drink more water and drink less sweetened beverages. Let us eat, of course, the fresh fruits and vegetables. Let us know our numbers. We need to know our numbers. How do you know your numbers? By having them checked. Some people do not know that they have high blood pressure. They don't know that they have diabetes because they have not had it checked. Go check your blood pressure, even if it's at a pharmacy in your neighborhood, at your local health center, at your general practitioner. Have your blood pressure, your blood sugar, have your cholesterol checked. And remember, women need to check pap smear, mammogram, men need to check prostate. Know your numbers means know your status, know your health status. And of course, we need to all get moving. We need to make movement part of our day. We talk about using the elevator instead of the stairs, so I'll remind us that we can do that. We can park further away so we have a further distance to walk. You can walk up the stairs in your home. You can walk around your home. You can walk in your neighborhood. So get moving does not always have to mean getting to a gym. And of course, playing sports. If it is you have sporting activities that you enjoy with friends and family, then by all means, we need to get moving. NCDs, or non-communicable diseases, are lifestyle diseases. And what does that mean? That means we have the power to manage, and we have the power to even avoid getting these diseases in the first place. Remember, your DNA is not your destiny. Let us all take control of our lives and let us shake that salt habit. Thank you.
And thank you very much, Dr. St. Bernard, for another very comprehensive presentation. Up next is our question and answer segment. We ask the media representatives to state their name and the name of their media house before posing your questions. We are requesting a maximum of 2 questions per media house in the first instance, after which we will field additional questions from you as time permits. And so with that, we start off with azpnews.com.
Hi, good morning. Suan Weil from azpnews.com. And my 2 questions, one is to Dr. Hines, the first one, and the second one is to CMO. Dr. Hines, there seems to be a regular trend, downward trend, with respect to the number of active cases. We know that no one can say for sure when the pandemic will end and when we may go into the endemic stages, but can you perhaps give a projection based on the current trends? And are we also still in the third wave of the pandemic, or coming out of it? And to CMO, someone sent us this question to ask. I was able to get my 3rd primary dose of AstraZeneca, but She's 62 years old, suffering from an autoimmune diseases, and she's on immunosuppressive drugs. And she's had 3 primary doses of the COVID vaccine. At the end of April, it would be 6 months since she had her third dose, and she's asking, do I now need to get my booster, or are those 3 primary doses enough? Thank you.
Okay, thanks for the first question. Now, it is really difficult at this point to do any sort of projecting for the simple reason that there are a couple of things in play that actually answer the second part of your two-part first question. The introduction of a second variant on top of the existing variant that was responsible for the start of this wave. So Delta started the wave and Omicron was superimposed upon it. Means that we are, yes, we're still in that wave, although the numbers are going down. But because Omicron itself is a little bit stealthy, we do know that there are going to be a lot of what we call subclinical cases, lots of people who are still currently getting ill, and they're not ill enough that they need to present themselves to the healthcare facilities. So we may not be seeing all of the illness presenting when we look at the numbers of new positives. But we do note that the severity of that illness has been going downwards, and we're seeing that reflected in the hospital trends. And while we would be happy if this continued, it's difficult to project for the simple reason that we know that there's always the possibility of another variant on the horizon. There are reports of mixtures of existing variants, etc., that we do need to keep an eye on. So projecting will be a little bit dangerous at this point. We do want to continue to encourage all persons to continue to adhere to the existing regulations that will help us to reduce our risk of infection at this point in time, and to adhere to the recommendation to get your vaccine if you haven't done so already. So that would be the recommendation at this point in time. Even as you see a downward trend in the numbers, we still have to look at what may be on the horizon.
Okay, and thank you for the second question. So it has been an issue that has arose from time to time, and people have asked the question, if you have a primary series, which is an additional dose, do you need to have a booster? And the answer is yes. So for example, if you had 3 Sinopharm, then you will want to have a booster 6 months after your final 3rd dose. Similarly for any other type of vaccine. So generally speaking, the name implies primary additional dose, means that it allows you to build the requisite protection that is afforded for other individuals. For example, you mentioned an immunocompromised person. That person may not be able to mount the type of response you would see in a person who is not immunocompromised, having had less doses. So you complete your primary series based on what you require, and then you have a booster. So for that particular individual, certainly a booster can be had after 6 months of completion of the primary series.
Newsday, we're ready for you.
Good morning. This is Paula Linder from the Newsday. My first question is to Dr. Parasram. Seeing as how we've been seeing this decreasing trend in the number of cases, and we haven't had any spikes from either the reopening of public transport or from Carnival, do you think our recommendation can be made for the safe zone policy to be withdrawn? And my second question is, Dr. Hines spoke about keeping an eye out for variants. Have there been any more cases of the stealth variant of Omicron, which is currently causing an outbreak in China here in Trinidad and Tobago? Thank you.
So I think Dr. Hines would have gone into significant detail with regards to that first question that you asked, in terms of what we see and the need for us to be cautious in terms of making predictions into the future. So we have to be cautious. And as we always say, recommendations continue to be made from the Ministry of Health to the Honorable Minister, and then decisions related to reopening and closing of the economy always lies with the Cabinet and the Honorable Prime Minister. Your second question focuses on, just remind me of the second one quickly. Sorry, yes. So the variant of concern, as As we know, it is Omicron. The BA2 that we picked up a couple of weeks ago is really a sublineage of the same. We haven't recorded any other BA2 so far, but we continue, as you know, Omicron is the dominant variant of concern in Trinidad and Tobago.
Thank you very much. And with that, we go to Guardian Media Limited. Good morning.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. Okay, so I just kind of want, my questions will just kind of follow on to the discussion that we've been having. So, Mr. Hines, Dr. Hines, sorry, you would have indicated that one of the reasons that we may be seeing these lower numbers of cases is because of the mild illness and people not really coming forward and presenting themselves for testing. But I mean, from a ministry perspective and one that is tasked with policy and stuff going forward, how do you all view that lack of data per se? Is that something that is of concern? And I ask that with the context of even home test kits and people not reporting it and that kind of thing. And my second question is, do we see at any point in the near future probably a tailoring of our entry protocols?
Okay, so I'll take the...
So basically, in terms of the entry protocol, the same answer applies. We will keep monitoring the situation. As you saw recently, UK, I think, dropped all their entry protocols in their particular country. Bearing in mind, every country is different. UK is upwards of 75% in terms of their vaccination. Their booster program is going very well. There are different phases of the Omicron wave. They're probably on the tail end. So we have to take all factors into consideration. But generally speaking, as we plan on going forward, certainly there will be adjustments in terms of the entry protocol. As you would have noted, just about a week or two ago, the Honorable Prime Minister would have announced changes to the quarantine time. And we are continuously looking through the subcommittee under my stewardship at those entry protocols. And of course, once changes are made and sanctioned by the Honorable Prime Minister and the Cabinet, then of course you all will be made take notice of it, and we'll of course take the necessary steps to inform the airlines and persons abroad as well. Just before Dr. Hines goes, in terms of what we look at, and most importantly right now, is the hospitalization data. We have a variant that seems to be, on the face of it, less severe than the Delta, of course, more transmissible, meaning more asymptomatic spread. What has been our yardstick for the last couple of weeks or months is looking at the hospital level. So we're really concerned about who comes to hospital, number of deaths, and we have seen a declining trend in both of them, which is very good news. Knowing how many cases of a particular disease there are in terms of asymptomatic spread is not necessary something that has to be done, and it needs to be borne in mind the cost to actually do that. Some countries have, for example, taken a widespread testing strategy where they test everyone in the entire country. You know, those countries that are trying to get to different phases, for example, China at one point would have tested quite a large number of their population. So the testing strategy is geared towards looking and seeing what are the outcomes in our hospital patients. So those persons presenting in the health centers and the hospitals are the ones that we want to know quickly if they are COVID or not. So our management will be geared towards the parallel system or the regular system. So Dr. Hines?
Yeah, thank you, CMO. Just to add to what CMO has said, what we're looking at is not a lack of data. We're seeing what we would consider to be a consistent spectrum of illness presenting to the healthcare facilities. The more severe individuals who need additional healthcare are the ones who present for testing and then present for care. And that is the spectrum of illness that we need to pay attention to from a public health perspective. So as we look at the effects of the virus spreading through the population, as the CMO rightly said, one of the key yardsticks would be the hospitalization rates and the fatality rates, because those show us what's really happening at the level of care needed, at the level of impact on the population. So it's not a lack of data. What we're seeing is that as we have a variant that is less virulent, less severely disease-causing, we then have a better opportunity to pay attention to a smaller number of individuals with the severity of illness at the end of the spectrum that requires healthcare. So we're not missing data in that regard. What we are doing is we are moving towards focusing the resources on those who need them most with the data that we have. So I think that adds a little bit to what the CMO has already said, but he's covered it quite comprehensively.
Thank you for your questions. With that, we go to TV6.
Good morning, gentlemen, and of course, lady. We do have one lady doctor there. Good morning to you all. Rishi from TV6. Dr. Parasram, as it relates to excess deaths, we're a couple years into the pandemic, and I haven't heard any information on this. Are you able to tell us if and why it's being withheld? One. Two, as it relates to the vaccination of children, are you able to give us an update on those vaccines, given that school is more than likely coded to be opened in April, and we would want to have sufficient time to be able to vaccinate those eligible children? As a point of clarification, Dr. Parasram,
So we'll take the two questions and then come back. Just hold that third question. We'll just answer the two, and then we'll come back to you.
Yeah, so as it relates to the vaccination of the children 5 to 11, as the Honourable Minister would have said on more than one occasion, we're actually pursuing through the CARICOM track. There's one initiative through CARICOM where we're looking at purchasing as a group of CARICOM nations, and there's another bilateral arrangement that we are pursuing directly with Pfizer, for which we have an NDA in place. So those are the two main measures we're looking at to get them here as quickly as we can. We are trying our best to get them into the country as quickly as we can through those two main mechanisms, and exploring other ways to get it here as soon as we can.
Okay, and with respect to the question on excess deaths, definitely no information is being withheld. It hasn't been a topic of specific conversation in recent times. It's information that we can present in more detail, but just on the face of it, what we did note for 2021 as compared to 2020 and the 5 years of average data before that, is that there was an increase in the total mortality, that's what you call all-cause mortality, by about 40% or so. And that is sort of in line with what other countries have been seeing. And we note that of that, what we would call an excess, about half of those we accounted for with actual COVID positives, noting that the excess mortality happens not only because of the number of COVID cases that have passed, but also individuals that would have passed on from other healthcare-related issues that suffered from the disruptions that a pandemic would cause. So we do have that information, and we can endeavor to actually put that together and share that at an upcoming conference. But there is that general information that we have actually, I believe, spoken about before, but maybe not in detail. So we'd be happy to actually share more of that in a subsequent conference.
Thank you very much, Dr. Hines. And we want to remind viewers again that this week is World Salt Awareness Week, and we do have Dr. St. Bernard here in studio to address any questions that you may have. And with that, we go back to Newsday for a follow-up question. Ms. Lindo?
Good morning again. Good morning again. So my next follow-up question is, can you give us an update on the progress of the seropositivity study that was announced by the minister? Thank you.
Yeah, I think we're going along pretty well. We have established two teams, two main teams, one at the Ministry of Health. So as the minister would have said, we are leading from the Ministry of Health. We would have had a meeting with the University of the West Indies just about last week. They're about to finalize both teams. We have a document in process going towards ethical approval, but by both the Ministry of Health and the UE ethics committees. And of course, we're in the process of doing a costing, which is being presented by UE to the ministry so that we can get the necessary consumables to go forward. So we are moving forward on it. Don't have any fixed timeline as yet for the start, but as soon as we do, we will let you know.
Thank you very much, CMO. And with that, we go back to Guardian Media Limited for your follow-up question.
All right. Thank you again, Al. This question is a bit of a follow-up, and I understand it might be a bit weird, but given that Carnival recently concluded just over around 2 to 3 weeks ago, and we would have seen so many outside of the safe zone events, we would have also seen reports of illegitimate ones where people would have been having their own little parties and whatever. To the panel, is it a bit concerning or intriguing that we've continued to see that downward trajectory in cases?
Sure. So, interestingly enough, I don't know if we can put back that epidemic curve very quickly. That would be my first slide after the CMO. So, what we're seeing and what we did notice is that in that first week of March, at the end of the first week of March, there was a bit of a peak that was higher than the other days in March. That's the epidemic curve. Just put that slide back up. Can we make that any bigger rather than get rid of the people and just magnify the slide? So whereas the other days in March, thanks. Now we need to get rid of the bottom third. Perfect. If you look all the way over to the right, those last few bars on the right, we see that there is a relatively tall one that's taller than the others for that week. And there was what we consider to be an unusual number of cases for one day. That was March 7th, which is about a week after the official carnival weekend and maybe a week or two after some of those additional activities that you'd be referring to. So while we did see that upward peak, that uptick, it wasn't something that caused enough significant severe illness to burden the healthcare system. So it's not that it's concerning that we're missing data. Again, we see it, we know what it's from, but the impact has been mitigated by a few things, and one of them is the severity of the illness itself. The other is that the protocols that would have been in place to reduce risk may also have contributed to blunting or mitigating that impact. So, interesting question. Thanks for bringing that up and reminding me to point that out.
Thank you very much, Dr. Hines. We go back to TV6 for a follow-up question.
Thank you, Mr. Alexander. So, Dr. Hines, just correct me if I'm wrong. So you're saying that there was a 40% increase in 2021 compared to 2020 and those previous years, and that half of that, so that would be 20%, would be not COVID related per se. Are you able to give us some general areas as to where, why, and how those excess deaths would have occurred? Maybe, I don't know, I've been hearing about cancer treatment had been suspended for a while. Did you see additional deaths there, or in which other general areas? Thank you.
Okay, so that's a little more difficult for the simple reason of what we get is sort of that raw numerical data that gives you numbers of all-cause deaths. And we know that out of that number, we had confirmed a specific number of COVID positives. So that's how we can give you that that breakdown of about half of the excess in total we know we've accounted for with COVID deaths in particular. The additional breakdown would require the sort of background work that is normally done with mortality data that takes a little longer. So you usually see formal mortality statistics provided sometimes a year or two actually after the year is completed, because you have to go back and what they call clean up the data, verify, validate, etc. So we are quite keen to look at the areas in which those additional deaths would have occurred. It's not data we have in front of us, but it is work that is ongoing in the background. And of course, we will share that as soon as we are able to process it.
Thank you very much, Dr. Hines. And then we go to azpnews.com for a follow-up question.
Hi, thanks. With respect to the doses of COVID-19 vaccine, CMO, if you could probably just clarify or perhaps recommend the fourth dose for persons. Is this something you would recommend not just for the elderly and immunocompromised, but for everyone across the board 6 months after that booster shot, or are they okay with just 3 shots? Thank you.
So in terms of a fourth shot, some countries have already, Israel, for example, have already begun giving a fourth dose, and in other countries in the world, they actually started to do fourth dosing. You saw a statement from Pfizer saying that a fourth dose may be required, but it has not been fully assessed by the safe group of WHO as yet. Pronouncement, as far as I'm aware, hasn't been made in that regard. So we hold and we look at the data that is coming out of those countries that have begun to do fourth dosing, look at what is happening. It's very unpredictable in terms of the nature of Omicron and how it is going forward, to determine if we will need a fourth dose, if and when, and certainly timing. What we have to look at is the length of time that our immune response has been lasting with 3 doses. And I suppose only time will tell how long it will last, so we need some time to ascertain that. Even in Trinidad and Tobago, as you asked about, the antibody studies will give us some local information as well, post our booster, how long our immunity will last. So we're hoping to get some data even locally to answer that question. But I don't think from our standpoint that the data set is complete to be able to answer it with certainty.
Thank you very much, CMO. We go to Newsday for your follow-up question.
Hi, good day again. My question is for Dr. St. Bernard. So you gave us some tips for reducing salt, etc., and also for eating healthier, but people finding time to cook for a lot of people is not always accessible. So what tips can you give people who are busy, who may have 3 or 4 children at home, who work long hours in their jobs, to be able to maintain this healthy lifestyle while doing everything else that they need to do to stay alive?
Okay, that's a very good question. Thank you for asking. One, I would look at it from 2 sides. One, you can actually I was not suggesting, of course, that you go from not cooking at all to now finding time to cook 7 days a week, because we know that is a very, very, it's a hard task, and it's a big ask. So what we can look at is perhaps even I've seen, ideas on YouTube, and so what people do is sometimes they would take like one day and cook a few meals. So whether it's, 1 or 2 or 3 meals, and that's the meal that basically keeps coming back. So, what you cook for Monday, you don't eat Monday, Tuesday, you might eat Monday, Wednesday, and then you eat something else Tuesday, Thursday, and then, you might have soup Saturday. So there's those kinds of options. And I know the other thing you might be asking is, well, even if I were to be having to buy food outside, is there a way to still go healthier? And of course, the answer to that would be yes. If it is you do absolutely bound to have to buy food from outside, you always have options. So, for example, if you're going to buy from any of those, establishments that sell the salty fried foods, what you may want to do is, if it is you can have, say, the rotisserie form instead of the deep fried, or if you can choose the salad or the corn or the potato instead of the fries, you try to then, or you may just order one part of the meal, and then when you go home, you just add a salad with it. So there are ways or if you go to, say, the food courts, you might want to avoid all of this starchy stuff and just go for the meats and the salad or the meats and the veg. So you want to just keep in mind that you are trying to provide your family with healthier options. And I'm glad that you mentioned, people who have children, because children learn from us. And so it is possible to kind of teach children that even in terms of what they expect as a snack, that fruit is a snack. That, chopped up carrots, that's your snack. It does not have to be something that's packaged. But in terms of the cooking, I think that when you do find time, let's say one day for the week or on one Saturday or one Sunday, you try to prepare as many things as possible. You freeze, and then maybe you just do the sides to go with it. I know one family who prepared meats for the term, and then they would just, boil the rice or the pasta to go with the peas and the meats that are already prepared and in the freezer. So I hope that helps in some way.
Thank you, Dr. St. Bernard. I have a question. Is there healthy salt? I know that there's this pink salt. Is that healthier than the average salt, and would you recommend that salt to be used?
So that's an excellent question, Al. There is something called Himalaya salt, or the pink Himalaya salt. And the reason that has become a very popular salt is because the sodium content is actually 1/3 less than the sodium content in table salt. So the sodium content in the Himalaya salt is actually 1680 milligrams. So if you look at the 1600, say versus 2400, it's literally 1/3 less. And the reason that it would then be something that you can use is that you're still getting the salty flavor in your food, but you are actually consuming a lot less sodium. And studies have shown that people in countries where they have tried to experiment with putting less salt in packaged foods, the population did not complain. It's almost like they don't even notice, which means that you do not need to be afraid to actually put less salt in your food. don't be afraid that your family will, reject you and not want to eat the food, because sometimes you put less and the food tastes just as good because you're putting all the good stuff like your coconut milk and herbs and spices, etc., etc.
Thanks a lot for that. Tobago Channel 5, we're ready for your 2 questions. Tobago? Okay, so we'll go to Guardian Media Limited.
Hi, morning. Yeah,
Yes.
I was hearing Tobago Channel 5, but I'll go ahead with my question real quick then.
Yes.
So this is for both Dr. Hines and the CMO. Now, I know we're in that period right now where we're transitioning in towards endemicity of COVID-19. But what I want to know and want to find out is, what does that look like? What does an endemic situation look like to the Ministry of Health? And I'm speaking in context of the caseload, the mortality rate, those kind of things. What is a comfortable place where we could say, yes, this thing is endemic and we're moving on?
Yeah, so last week I would have presented on the difference between endemic, epidemic, and pandemic, right? Something being endemic means it is in a place for in one geographic location, circulating at a certain level for a long period of time. The pandemic is 2.5 years in. The other thing that we look to is, of course, the impact on the health services. I think when it is no longer a major threat to the health services of the country, we can begin to feel a bit of comfort that this thing is not going to spike on us all of a sudden and create an overwhelming situation in terms of the capacity of the healthcare system to cope with a surge, right? So with endemic diseases that I would have presented, for example, influenza, you would have seen during the periods October and May of any given year, which is called the influenza season in the Northern Hemisphere, you will expect that a rise in number of cases will happen. But generally speaking, it doesn't overwhelm the healthcare system in a particular jurisdiction. And I think that's where we have to get to be in a position of comfort, that we know with some level of certainty, which is difficult to do right now. As Dr. Hines said, we on the outside of Delta. We were at the outside of Delta, and then Omicron came on top of Delta. And now we're seeing that down surge, hopefully meaning the tailing off of Omicron as well. So we're in a difficult position of uncertainty as it relates to what is going to happen next. We are all a bit cautious, I think, in the world to make predictions going forward, because you're seeing surges in other countries. For example, in Hong Kong and different parts of the world, in China, in New Zealand, which didn't have cases for many, many months, saw a spike of over 22,000 cases in one day. So we have to be cautious with our predictions, but we're looking at a place where our health systems are not under threat, and we can retract that parallel system and consolidate it to a phase that we are comfortable managing the disease. I don't know if Dr. Hines wants to add any epi to it.
Okay, just to again support what CMO said, and to point out something that I think sometimes gets missed when we speak about endemicity. Endemicity doesn't mean, okay, we can ignore this now. Endemicity means that we now understand the pattern that this particular virus follows. And as the CMO said, we're in a place where its changes don't necessarily overwhelm the healthcare system. But an endemic disease is still one that you have to prepare your healthcare system for, using the information on patterns to know when to expect more, when to address more resources or allocate more resources to predictable surges, and also knowing how to mitigate those by utilizing preventive measures such as the vaccines. So endemic doesn't mean, okay, now we ignore it. Endemic means we know what to do with it, and we know how to prevent it from overwhelming our healthcare systems. And that, again, will take some time because the disease is still establishing itself, the virus is still changing a bit, and we do not want to run away with the idea that endemic means, okay, this is behind us, we can completely ignore it and act as though it's not there, because that's not what it means. It means that we're aware of it, it has a pattern, we know what the pattern is now, we know what kind of impact that has on the healthcare system, and we also have the ability to manage changes, especially surges, as the virus does what it does in its endemic state. So just to put that context into it as well. Thank you.
Thanks for that clarification. We want to go back to Tobago Channel 5 to see if the audio problem has been rectified. Tobago Channel 5.
Good morning, Natalie Singh, Tobago Channel 5 News.
We are hearing
Are
you.
you
Go
hearing
ahead.
me?
Yes, please go ahead.
Basically, we've seen a slight increase in COVID-19 cases, but in Trinidad, we're seeing a slow of the cases. Is it then that we're still considered to be endemic? And is this of concern to the Ministry of Health professionals? My second question goes to Dr. Bernard. Sea salt, is that considered to be very bad, or it has a lot of writings online about its the good parts about it, but I just wanted to know Dr. Bernard's take on that. Thank you.
Hi.
Yeah, so
sorry,
Dr.
sorry.
Silmana, just before you go, so just to underscore, we are not endemic for COVID-19 in Trinidad and Tobago. We are still within a pandemic. We are in an epidemic in Trinidad and Tobago, and we are within a pandemic which has been called by WHO and has not been downgraded in any form or fashion as yet. What we have been saying over the past weeks is that we are preparing for if and when this disease becomes endemic to the country. So we are in a preparatory phase, looking towards endemicity as one of the outcomes of this potential pandemic. So I hope that clarifies the question.
Thank you, CMO. Dr. Simanan.
Right. Hi. Thanks for that question. So I think the concern that you may have heard about is that sea salt is not iodized, does not have iodine. So that if it is, remember the reason that they added iodine to table salt was a way for us to get that mineral into everyone. So people may need to be careful that if they consume sea salt and don't have any other source of iodine for their diet, they may end up low in iodine, and that is a whole next story in terms of the things to look out for with that. But that's the thing to keep in mind. Other than that, sea salt is actually a pretty good alternative to table salt and, of course, the pink salt. So that might be the concern you may have heard. But sea salt is not known to be bad in any way and dangerous, So hope that helps.
Yes, it does. Thanks a lot, Dr. Sid Manard. And with that, we go back to TV6 for your follow-up question.
Thank you again. Dr. St. Bernard, this one is for you. I know you're here to talk about salt essentially, but every time we talk about this healthier diet and so on, it always strikes me that, eating healthy is always related to cost. It costs more to eat healthy. Is it that you think poor people suffer the most? Because, you go to the grocery, a pack of ramen is $2-3. And here we are sitting and talking about, types of oil that we should use and fruits, vegetables. We all know these things are very expensive, particularly for the marginalized person. Is it more difficult to eat healthy? Is it more difficult for poor people to eat healthier?
Thank you for that question. That's always a tricky one. The question of if eating healthier is more expensive. There are ways to eat healthy and not have to, really suffer in your pocket. But it would mean that you do have to probably exclude a lot of the unhealthy, snacks and those things. So even now, when people have been talking about the rising cost of fuel, the first thing people say is we will be going back to market and not buying, our vegetables, for example, in the grocery. So I'm not saying by any means that it's going to be easy. But I think that if people focused on eating the healthier options in terms of the vegetables, even let's say meat is expensive, you can get healthy protein from your peas and beans, which are very affordable. So I know that it would take some effort, and maybe that's a topic for another day. But there is a way to eat healthy and it still be affordable. And certainly ramen is not something I would want to promote, because that's actually a very good example of something that's extremely high in sodium. So that, unfortunately, is not something that we would want anyone to consume on a regular basis. Hope that helps.
Thank you so very much, Dr. Sid Bernard. And we go back to azpnews.com.
Hi, my question is to Dr. St. Bernard, and basically, Urvashi said it quite frankly that eating healthy can be expensive. But the question that I want to ask is, with that in mind, will ministry officials be hopefully soon looking to recommend to central government that a reduction be made on certain healthy food items that perhaps the ministry can provide a listing for? Thank you.
Again, I think it's a little early in the day in terms of that policy recommendation. As you know, the ministry will look at all factors. There's a food advisory committee that is at the Ministry of Health, which is now being chaired by the newly there's a new coordinator, NCD coordinator, who has come on board on the Ministry of Health, now taking over the chairmanship of that particular committee. And that committee also has the chief nutritionist of the Ministry of Health, the director of Food and Drug, other stakeholders from Ministry of Trade, etc. And a lot of recommendations may be coming out of them very soon. And of course, we will take it into consideration when they make those recommendations. But we'll look to them for those types of recommendations, of course, looking at what is happening outside as well. And then the policy decisions will be taken by the cabinet and the government of the country.
Thank you, CMO. And our final question goes to Guardian Media Limited. Guardian Media.
All right, thank you again, Al. So this one is to the CMO. CMO, I know that there were some plans in place on the ministry's side to help encourage vaccination and to get people vaccinated. But I mean, compared to what we would have been seeing late last year and early this year, it seems as though the push has dwindled a bit when it comes to getting, or has taken a less aggressive approach when it comes to getting people vaccinated. So where are we on that? Is there anything in the works to probably retailor some programs and get that vaccination numbers up?
Yeah, so you always have to have continuous review of your communication strategy and even your vaccination plans, especially in light of a pandemic where a lot of things are uncertain. And you have new factors coming on board every day. So we are in the process of relooking the communication strategy as well as the way we focus. So the focus has to be on the ground now. So we're working with NGOs, we're working with TTMA, for example, to try to get on the ground community-led programs. So the focus is really on the ground and away from that mass media sort of approach and even the mass vaccination site approach. We're going back to the health centers, going back to the nurses doing their job, as they have always been doing, meaning going out to the community and doing outreach programs. So that is the focus right now, to get to those communities that are far-flung and to those persons that are a little bit hesitant, need to get a little more information from their trusted healthcare worker before they make that final decision. In terms of the booster program, we keep going ahead with the persons that are known to us to try to reach out to those to get them to come in on time for their booster as well. But it is a continuously evolving process, and we'll keep going at it as long as we can.
Thank you very much, CMO, other presenters, you, the media, and of course our viewing and listening public. And in closing, we ask you to please continue to protect yourself and your loved ones. Remember, the COVID-19 vaccines are World Health Organization approved. They are safe, effective, they are free, available and accessible. No appointments are necessary at any of the locations. These vaccines are available in all 5 regional health authorities and at all 109 public health centers throughout Trinidad and Tobago. We want to remind you to practice the 3 W's, and if you have not received the COVID-19 vaccination as yet or due for your booster, please get yours now. Don't delay, vaccinate today. Be safe and goodbye for now.
Alright, well, I got my first jab and I would say that the experience, it exceeded my expectations. Everything went quickly, everything went smoothly. I would say the customer service was excellent. It helped me from an anxious perspective because I was really apprehensive, obviously, with all the rumors going around with regards to the vaccine. But being here and actually seeing everyone trying to do the right thing and being attended to by such courteous staff, making the process as easy as possible, and their willingness to answer all your questions has made the process easier for me, physically and mentally. So, kudos.
Don't delay. Get vaccinated today. A message from the Ministry of Health.
Salam